Hello, I'm Dr. Jimmy Douglas, and today we'll see how to correctly start oral contraceptive pills to prevent pregnancy. Before starting the pill, you should make sure with your doctor whether you can take oral contraceptive pills or not, considering your health and medical history. These are available as 28 days pack, of which 21 are active pills and 7 are inactive pills, or 21 days pack in which all are active pills. Active pill means it contains hormones in combination. So it is called combination oral contraceptive pills. These pills contain estrogen and progestogen in different doses. When the period starts, or when the bleeding occurs, or when your menstruation starts, this is called the first day of the next cycle. You are advised to start on the first day of the menstrual cycle, 5 days following the first menstrual day, or first Sunday following the first menstrual day. Now for the 28-day pack, first tablet should be taken on the first day of the menstrual cycle, and then every day till the 21st day. And on 22nd day to 28th day is the inactive pill section, where you would have the bleeding. These inactive pills are also called as sugar pills, and some brands contain iron or folic acid. For the 21-day packet, the first pill should be started on the 5th day of the menstrual cycle, every day for 21 days, followed by a break for the next 7 days. That is, no tablet for 7 days after taking tablets every day for the first 21 days. First course should be started strictly on the 5th day of the cycle, and any deviation might not be able to prevent pregnancy. During these 7 days break, menstruation occurs. It might be 2 to 4 days after finishing 21 tablets. After 7 days break, again start the new packet and continue. Sometimes, even if the periods have not stopped, you continue with new pack. The bleeding which occurs is not like normal menstruation, but an episode of bleeding from an incompletely formed endometrium. It is called withdrawal bleeding. Withdrawal because bleeding occurs due to withdrawal of hormones being given in the form of a pill. The pill must be taken every day at a fixed time after food, preferably before going to bed at night, irrespective of whether you are intending to have sexual intercourse or not. In case you forgot to take the pill, then take it as soon as you remember it, and the next day at the same fixed time after food. More pills you miss, the greater the chances of getting pregnant, and your partner should use condoms along with the regular contraceptives. Can we immediately start having sex after starting oral combined contraceptive pills? Even if you start taking tablets at any day of your menstrual cycle, you will not be protected from pregnancy straight away, and you will need additional contraception until you have taken the tablets for at least 7 days. The mode of action of pills is to stop the release of ovum or egg from the ovaries, so ovulation does not occur. The egg or ovum is not released from the ovary. So whatever bleeding that happens while you are on pills is not actual menstruation, it's withdrawal bleeding. The pills also render the cervical mucus thick and scanty, and thereby inhibit sperm penetration. Effectiveness of the combined oral contraceptive pills. If taken as prescribed, these tablets are almost 100% effective in preventing pregnancy. Failure rate increases as not all women take it regularly. In developed countries, the annual pregnancy rate is less than 1% and considerably higher in developing countries. Being on the pill removes the anxiety of the risk of unplanned pregnancy. Women taking oral contraceptive pills must consult the doctor if they experience severe abdominal pain, chest pain, shortness of breath, severe headache, vision problems, severe leg pains. Thank you for watching, and see you in the next video. Bye-bye.